every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darabite. Love yourself.
Diphtheria is a highly contagious vaccine-preventable disease caused mainly by the bacteria Corynebacterium diphtheriae, but also by Corynebacterium ulcerans. Diphtheria can be fatal in 5 to 10% of cases, with a higher mortality rate in young children. It spreads between people mainly by direct contact or through the air via respiratory droplets. The disease can affect all age groups. However, unimmunized children are most at risk. Symptoms often come on gradually, beginning with a sore throat and fever. In severe cases, the bacteria produces a poison, also known as toxin, that causes a thick gray or white patch at the back of throat. This can block the airways, making it hard to breathe or swallow, and also creates a barking cough. The neck may swell in parts due to enlarged lymph nodes. Nigeria has recorded diphtheria outbreaks in the past, notably in 2011 and 2022. In 2023, a previous outbreak of diphtheria was recorded between January and April 2023, affecting 21 of the 36 states and the Federal Capital Territory. Since this outbreak on diphtheria in Nigeria was published on 27 April 2023, the country has reported suspected cases of diphtheria weekly to WHO. However, between 30th June and 31st August 2023, Nigeria recorded an unusual increase in the number of confirmed diphtheria cases. Why is this so? Today on your regular Health TV show, we'll be discussing vaccine-preventable disease, diphtheria. Stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your anchor for today's program. We'll be discussing vaccine-preventable disease, diphtheria. I'm sure you have been hearing about this particular name, diphtheria. It is time to bring it to you on your regular Health TV talk show, The Physicians. With me in the studio, I have my very cerebral public health physician, a consultant, Dr. Alero Roberts. You're welcome to our program.
Thank you. Thank you so much for having me.
I know you're very excited because we're talking about diphtheria, the outbreak. As a grassroots physician, one who's always there, public health physician.
I won't say the sentiment is excitement. I say the sentiment is extreme concern.
Yeah.
That a lot of people don't realize that there's still a diphtheria outbreak going on.
What is diphtheria?
Well, like quite rightly said in the introduction, is a disease of the nose, throat, and skin. The most serious ones being in the nose and throat. It can start with the sore throat and fever. But the key thing with diphtheria is that grayish-white patch that the bacterium it produces a poison that causes this patch to develop over the back of the throat and the back of the nose, that whole area, that can block the airway and impact on the person's ability to breathe.
Okay.
And then, of course, the lymph nodes now enlarge in a way to fight the infection, and that enlargement now causes the neck to swell, further worsening the person's ability to breathe. Okay. So that's what makes it a particularly distressing disease. And the worst part is that once that toxin, because that toxin cannot be cured by any antibiotics. So if you start antibiotics or you start them too late or you start ineffective antibiotic therapy and that toxin has caused the patch to develop, drugs don't work anymore. The antibiotics don't work anymore.
So what are you insinuating?
What I'm insinuating is that it's a serious disease. It now requires hospitalization, intensive care, high dependency care, the kind of care we are finding it increasingly difficult to provide. So, you know, this is a disease that it is much better prevented.
It is much better prevented. What are the symptoms, if I may ask?
Very vague. Fever, you know, malaise, sore throat. So many people tend to overlook it, particularly if you are a young adult or an adult, or a young in the teenage years, you have a sore throat. And how many people don't get sore throat and fever? And, you know, and unfortunately, you may not pay it much attention until it becomes this more serious manifestation of the disease. That is the danger with diphtheria. Okay. But by that time, the airways are affected, the lymph nodes are growing, you know, all kinds of nasty things are happening. Is
there any particular age group that it affects?
Well, all ages. But of course, the case for fatality is worse the younger the patient is, because naturally the airways are smaller. The younger the child, the smaller the airways, the more quickly the airways are impacted. So it affects all ages. As it is right now, we are immunizing. If you have the routine immunization going on, we're immunizing the under 5s.
Okay.
But supposing a child didn't get immunized for one reason or another,
okay, or
was inadequately, partially immunized, or worse still, vaccinated but not immunized.
Yeah. So vaccinated but not immunized. That is probably because of the cold chain. A lot of things can have
happened. A lot of things could have happened. You know, the mother got to the health center late. The vaccine has been out for too long. That sort of thing. And a lot of that is taking place. Or in areas where the routine immunization program had broken down for reasons of strife and conflict and Boko Haram activities and cattle rearers being attacked, all those kind of activities. Or Japa syndrome.
Sure.
So there are no healthcare workers in some areas anymore.
Okay. Now we have, from my introduction, I'm sure you heard me. We just have some another outbreak. What is the situation now? What do you think is account responsible for this? Because it's actually a cause for concern.
It's a cause for major concern.
Now you have adults coming down with it.
Yes, and the worst part of it is that for every case that we get, healthcare workers who are already being depleted around the country are at risk. Because the patient is coming in and the healthcare workers are the first people to be exposed. So we're now, very, very worried that the health system, which is already straining under the Japa syndrome, under funding in all sorts of ways, the logistic management supply system is broken down. We're not getting our drugs and consumables as and when needed. All that strain on the healthcare system is now being complicated by the diphtheria outbreak. And it's happening in areas of the country that have a worse problem, as per the healthcare sector being affected.
Wow, this is not good news at all.
It's not good
So
news.
I think it just calls for more of the healthcare providers to be more alert.
Definitely they need to be more alert. But, even how alert can they be? Because what's going to happen is that what we call the primary care responders, the first place the patient will go, will now immediately think, supposing this is diphtheria, and immediately from the doorway start turning patients away to a higher level of care, which is already under a lot of strain. This is what we are seeing, and this then happens. We have isolation centers that are already full to capacity, or some isolation centers that cannot even be open because we lack the personnel to keep it going.
Okay.
And all this because of a breakdown in routine immunization programs.
Okay. Talking about a breakdown in routine immunization programs, I know diphtheria is part of the routine immunization that they give to children. Are they supposed to have a follow-up, like a booster dose?
Well, this is the thing. Now, we know where this came from, in parts, and I'm very careful with my words here. When we were busy trying to eradicate polio, you remember we were carrying out all kinds of national immunization days, we were sending people out, because the polio vaccine lent itself to that kind of maneuverability.
Okay.
Okay? So it was faster that, oh, we have to really work hard, we have to eradicate this polio, let's send teams out. Now, what then happens is that because a lot of mothers are not very health literate,
True.
they now assume that they came to the church, they came to the mosque, they came to the daycare, that it covers.
Oh my goodness.
So
they just felt what they took covered everything in the DPT.
So they will now not take the child for the routine immunization in the center. Don't forget, this polio vaccine was coming to meet them where they were.
Where?
In the marketplaces, in the houses, in the places of recreation, and so on and so forth. So they were now not taking children for routine immunization. Then the counter to that was that the staff involved in the routine immunization were now also out doing polio. Hey. So for so many reasons, routine immunization programs were badly affected.
So this was actually a gap.
Exactly.
It was a gap.
Add to that the strife and conflict in many areas of the northeast of the country, and add to that the loss of healthcare personnel. Because even before COVID exposed it, we were already having the Japa syndrome. It's just that Nigerians were not paying much attention.
Okay.
We were having the loss of nurses, particularly. Okay. For many decades, we've had a loss of nurses in the country, and that wasn't being paid attention to. So for many reasons, we had this breakdown, this systematic breakdown in the routine immunization program. Okay. And therefore, we had a huge pool of young children who grew up into their early teens, late teens, early 20s, who were now at risk of diphtheria outbreak. We had one outbreak and boom, it has flown through the community like a wildfire in the Hamatan.
Okay, now that you have said all this, you did hear me talk about that it was on the increase, okay? When we come back from break, I want you to tell us about the current situation report. But I know you are the one, you're a grassroots public health physician. You always go to the areas, the corners where most people don't even want to delve into. I'll be back after the short break. So my dear listeners out there, it's time for us to keep a day with the physicians. Let's hear what you have to say. Have you heard about diphtheria before? Did you know about the outbreak? Were you immunized? If you were immunized, you heard what Dr. Alero said. It's possible to be vaccinated, but not immunized. We'll be back after this short break. Stay tuned.
No. Okay, no idea. Never think so. Not at all.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you have just joined us here on your regular health TV talk show, The Physicians, where your health is our business. In the studio, we have been discussing vaccine-preventable disease, diphtheria. Diphtheria is actually a vaccine-preventable disease, but unfortunately, we've had a series of outbreaks in Nigeria, 2023, and it's been on the increase. Dr. Alero Roberts is a consultant public health physician, and she has been telling us some of the things that we need to know about diphtheria, the mode of transmission, the causes and everything, and how it is actually preventable. Before we went to break, I told her that when we come back, she will tell us the situation report. What is the situation report right now? Dr. Alero Roberts, so what is the situation report right now?
Well, we've had an outbreak, the last outbreak since December 2022,
okay,
resulting in well over 12,000 suspected cases. 7,000, almost 7,500 cases were confirmed, and 471 deaths.
That is
yes,
high.
that is high. A 5.3% case fatality.
That is high.
Exactly. So now you understand, these deaths are not in the under 5s. They're in grown children, grown, late teens, early 20s that is happening. So as at 28th September 2023, this loss of life is already having its toll on healthcare workers.
Jeez.
That is the problem. The healthcare workers in Nigeria and the families of those who are ill. So that has caused disruption of service delivery, disruption of livelihood, and so on and so forth. Since July, we have had a spike of over 1,000 cases being reported weekly, and the epicenter is Kano State.
Wow.
But it has since spread to 19 states and 111 local government areas. So it's not a small matter at all. It's not a small matter at all.
It only calls for concern, really.
It is. It is definitely cause for concern. And, the speed with which these things jump into Lagos, because everybody, for the rest of Nigeria, Lagos is the medical tourism destination of choice. First and foremost, they feel that if they can't get anything,
help anyway in
they will
Lagos.
come to Lagos. In some states, the case fatality rate has been as high as 20%.
20%,
Yes, this
Dr.
year,
Alero.
it has been as high as 20%. So we're not playing with this thing at all. NCDC has been on top of this thing like white on rice.
So it's contagious, obviously.
Oh, very contagious.
So are you
Very contagious. Contact or airborne
would the
spread.
use of face masks also help?
We
for
can't do
those
what we did in COVID. Because it's not effective, in the sense that if you don't wear a face mask consistently and properly all the time, you might as well not bother. That's number one. Then we are now going to go to a situation of supply and availability and cleanliness and sanitation and disposal of, because you dispose of the face mask carelessly.
Yes.
You are still spreading infection.
Okay.
So these are all the other things, the infection control, prevention control measures that need to be in place. We simply don't have them anymore.
Okay, so we know that it's a vaccine preventable disease, right?
A vaccine preventable.
And that there's supposed to be a booster dose. Is there any particular, if for people that didn't have the booster
Right
dose,
now, the government has
have
made
it?
available vaccinations for free for healthcare workers and families of those who are affected. But if you are worried, go and ask for a vaccine. You will probably have to pay for it, but it is much, much cheaper to pay for a vaccine and get it now than to end up in intensive care or high dependency care in the hospital because somebody has developed.
How is the diagnosis made?
It's made in the hospital.
Okay.
But invariably, the diagnosis is made when the person is really ill already.
Sore throat and cough.
Sore throat,
Productive.
inability to breathe, high fever, and a high index of suspicion.
Okay. Okay, so we'll talk about the prevention.
Immunization.
Straight up.
Straight up. We need to strengthen the routine immunization programs. We need to ensure that every child is getting those first 3 doses of pentavalent vaccine, which includes diphtheria, tetanus, pertussis, the whooping cough, HIV, and HBV.
Okay.
We need to ensure that babies are getting that so that they are protected at least up to age 5.
Okay.
Where possible, we need to start pressing to make boosters available. But the truth of the matter is that if we can achieve good immunization coverage at the under 5, we'll have good herd immunity that will prevent this kind of outbreak.
Okay. Okay. After the regular doses they are supposed to have during the immunization, right? As a DPT, right? When is the booster supposed to be taken? At
5 years.
5 years. 12 years. So the way they are doing the HPV, going to places, churches, market to go and give to these girls, is it possible to also do this along with them?
It would have been ideal if we had the doses.
So
the doses first have to be acquired. What is available now is for the under 5s. So we cannot touch those doses.
Wow. Possible complications from this?
Sorry?
Possible complications? Death?
Yes.
Wow.
Let's be brutal and honest. Recovery can be slow, difficult. It costs a lot of money to treat because of the level of care that is needed, and the patient is at risk of dying. Okay.
So, for instance, one who is home now, let's say not even in the urban areas, in the rural communities, okay? A child is coughing, even an adult is coughing, having difficulty in breathing. What do you advise that they do?
They must go to the hospital. they must go to the nearest primary health care center. They must. Because it's not a diagnosis I'm going to sit on television and say, oh, if you see this, 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 and this, then you know it. No, 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 I will not do that. If a child is ill, that child needs to get to hospital. Let a trained healthcare professional look at that child and, you know, take the decision as to what should be done.
Okay, because they must take swab and all those things.
All those
everything.
Things. They need to report it and get a proper diagnosis, yes.
Wow. So now that we have talked about this, I wouldn't allow you to go without letting our audience really know the importance of vaccines.
How much more, how more seriously can I state it? Vaccines are the most safe and effective means of preventing many of these.
I'm saying this because of a lot of myths about it.
A lot of myths and misconceptions we know.
Yes.
But, you know, the same value we place on our babies, we need to place on ourselves and our children at the same time. Okay. If there is a vaccine available for anything, go and get it. It is so much cheaper to suffer the minor inconvenience of getting a vaccine, maybe a bit of pain at the injection site, than to put yourself at risk of far more serious disease that requires a whole lot of time and effort to treat and may not even have a good outcome.
It's sad.
That's why they're called vaccine preventable diseases. They kill, but they are preventable.
Maybe parents need to know more, mothers need to know more, and even community health care,
keep talking.
Yes, keep talking. We don't have a choice.
That's why we love programs like this, Dr. Martina, where you allow us to come out and keep reminding people about things like this, the importance of health literacy, the importance of asking questions. Yes, you may have concerns about the vaccines and so on and so forth. Please raise your concerns with trained health professionals and get scientifically accurate answers that address your concerns. It is vitally important. I always say it, there's no stupid question. The only stupid question is the one you failed to ask.
It also brings back the importance of the primary health care centers.
Absolutely.
Because if, for instance, I was just thinking, if, for instance, we have proper record, okay, keeping, and a mother doesn't bring a child for the vaccine,
yes,
you will know.
Yes.
If it's within the community where the child is not available, yes, the healthcare will need to ask.
Yes, you're very correct. Vibrant primary health care centers, particularly the ones I'm used to working with around me here in Lagos, have health promoters and health educators that alert the community that so and so we have not seen, is the child okay, the immunization is due and this and that. They know the people, they know the families, they know the children.
We can't overemphasize the importance of primary health care. Yes, we can't.
Those health educators, full respect, because they go out, and that is their job. The community health officers, the community health extension workers, they go out every day and they conduct outreaches into areas where people gather, the marketplaces, the churches, the mosques, the schools, to make sure that everybody is well aware of what is going on, what is available, and so on and so forth. It is so important.
Dr. Alero, there's no way you will come on our program and you just blow our minds, okay? I really appreciate you. I want to just say thank you for always being there for the physicians. So many people have actually sent messages and we've been always been asking our regards to Dr. Alero. We have learned so much from Dr. Alero Roberts. Thank you so much. I want to just appreciate you on that. And please don't be tired of us because we'll always invite you.
This is my work. This is what I do.
Thank you very much. And to our viewers, I just want to say thank you for keeping a date with us again on your regular Health TV Talk Show, The Physicians, where your health is our business, and we have vowed that we will always be our business. If you want to be part of this program, you just go to our website and send us a mail. So we'll be here to discuss like Dr. Alero Roberts always does. Follow us on our social media platforms, on Instagram, on Facebook. And of course, don't forget to call a neighbor, a friend, whenever you want to watch The Physicians. Till next time, stay blessed because my name is Dr. Martina Agbere.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darvite, love yourself.